Glucose screen complete. I passed my gestational diabetes screening. Right now it is 11:45 and I just got done eating a breakfast sandwich, which was so good, by the way. I made a little breakfast sandwich with steak on it, a fried egg, a little bit of cheese, mayo, tapatio hot sauce, a little bit of like spinach arugula mix on a piece of sourdough. And then this morning I went and got an iced latte. That's all I've had. I woke up around 6:30 and have drank 2 of these tall glasses of water so far. Well, one, this is my second one. And then the latte. I usually wait to eat until I get hungry, which is around usually like lunch, brunch time frame. And then we'll go to do the diabetes screening. It just really depends on your glucose screening, whether it's gonna be like the 1 hour non-fasting or if you're gonna be doing it fasting. So make sure you ask your doctor about that. With non-fasting, it's good to just go about your normal routine, how you would normally go about eating for that day, and then maybe go in to do your labs like 2 or 3 hours after you ate. That'll give your blood sugars time to like level off and you won't go in right when you ate and have a high screening that's not accurate. That's the plan, to go around like 2 o'clock or 2:30 or so and start doing the gestational diabetes screening. Luckily they have this beautiful, lovely fountain for me to sit by. Okay, so they just gave me this drink. It's basically like a water bottle. It looks like a water bottle. And then this is the brand. Glucose tolerance test. They told me to drink this and not have a lot of movement and stay in the lobby and then come back up in an hour. It actually doesn't taste bad. I thought it was gonna be a lot more nasty. I mean, I wouldn't drink this, but it's like a little flat soda, lemon lime flavor. I've heard if you fail this test and you have to do the 3 hour, that drink is way more disgusting. The ingredients of this is 5.0 grams of glucose per floor ounce. The recommended dosage is 10 ounces, which is 50 grams. It's water, dextrose, natural flavoring, citric acid, and sodium benzoate. It says the most common adverse reactions are nausea, vomiting, and abdominal bloating or headache. Start timing when patient begins to drink, and obtain blood sample 1 hour later. There's some beautiful pink flowers blooming out here. Okay, it's been almost an hour since I drank the drink. So far, I just have like a little bit of heartburn. I don't really feel nauseous, headachy, nothing like that yet. Hopefully I don't feel like that this afternoon. But I'm just waiting to go back in. They're gonna draw my blood and we'll see what my levels are and if I passed. We did all of my 24-week labs with the gestational diabetes screening. So we did the glucose, the RPR, and then CBC. The screening is done between 24 and 28 weeks of pregnancy, and currently I'm 26 weeks pregnant. I ended up not really having any signs and symptoms from the glucose screening. I was a little bit nervous because I heard so many people say like, I felt nauseous, I had a headache, like it was horrible, and I didn't really have that experience. I think when I drank the drink, I definitely started to get heartburn, maybe like 30 minutes after drinking it. But I never really got nauseous. I never got a headache, nothing like that. I was starving. Like, I think my sugar probably, like, once my body caught up with soaking in all of that sugar, it dropped my levels, and then I was really hungry and I felt like a little bit irritated. Like, but that's it. Like, just a little bit irritable and starving. So overall, it was not bad at all. I still don't have the results. I was checking my portal to see if they would pop up, but they didn't give them to me on site. My sister said that when she went and got her screening done, they gave them to her the same exact day. They told her if she passed or not, but just the way that my facility is, I have to wait for it to come out on the portal. And not to mention, it's a holiday. I did the test on New Year's Eve, and so yeah, no one's working today. So I probably won't get results for another couple of days, but that's okay. We'll see if I passed, and as soon as I have those results, I will share them with you guys. My blood glucose levels ended up coming back at 134, and my clinic uses a range of 135 or less to pass. Some places use 140, but after doing a little bit of research, I figured out that really anything over like 190 is considered gestational diabetes. I know it seems like I was kind of like right on the cusp at 134. When I was looking at that result, I'm like, that's pretty close. So hopefully they don't make me repeat the screening, but I do work with OB doctors, and so I'm going to bring it up and just ask what they think. And it looks like most places use the number of 140, and that even if you score a 140, anything 140 or below, it means that you don't have gestational diabetes. So that is awesome. I'm hoping I do not have to take that test again. My CBC also came back because we drew those 24-week labs at the same time when I did my gestational diabetes screening. And it looks like my red blood cells, hemoglobin, and hematocrit are just like a little bit on the low side, but it's barely low and hasn't moved much since my last screening. So I'm thinking that they'll just keep a close eye on it, and I'll just keep taking my prenatal vitamins every night. The good thing is that my platelets are at 229, so that is amazing. I am planning on getting an epidural, and that is something that anesthesia looks at, that your platelets need to be over 80,000 in order to actually safely get an epidural. So I'm really happy with the 229. My neutrophils are a little bit elevated, and then my lymphocytes are a little bit low. My white blood cells this time when I did my CBC were totally normal. In pregnancy, just because of your immunity being low and the stress of your body carrying a baby, some of your labs can just be like a little bit off. I think as long as they're not too far, like high in one direction or low in another direction, as long as you're close to the reference range, then it's not something that they'll usually be concerned about. So I ended up talking with 2 different OBs that I work with, and what they told me is that a pass is a pass. They won't really have you redo the screening unless there's other risk factors. Some of those are like ethnicity, or if your baby is measuring large, if you have polyhydramnios, which is like too much amniotic fluid. If that's the case and you do have risk factors, then they'll do another screening in the 3rd trimester. I figured I'd take you guys on a little tour of a labor room in case you're interested, and if you have any questions about the labor and delivery process or labor rooms, anything like that, let me know and I can go over that in more detail. Next up is my 28-week OB appointment. We also scheduled an ultrasound at 32 weeks, and that will just be like an anatomy scan of baby, looking at growth and development, the blood flow through the umbilical cord, and also the placenta and the location. I still have a partial placenta previa, so they're keeping a close eye on that, as well as my cervical length. Hopefully by 32 weeks, baby will be head down and the placenta will be far enough away from the cervix to where it's safe to have a vaginal delivery. After the 28-week OB appointment, the next OB appointment won't be until 32 weeks as well. So much coming up. I can't believe that I'll be 30 weeks soon. That's just like right around the corner. The 3rd trimester of pregnancy starts at 28 weeks, and so we are right there, literally like almost in the 3rd trimester. Leave a comment to let me know how many weeks you are pregnant now, if you are pregnant, and I will talk to you guys soon in the next video. Mwah.